Pediatric health experts are scrambling to uncover why several children in the U.S. have developed severe cases of hepatitis. An investigation is now underway in at least 10 states. ABC News contributor and Boston Children's Hospital Chief Innovation Officer Dr. John Brownstein joins me live now for more on this. Dr. Brownstein, last week, the CDC issued this nationwide alert about global hepatitis, this outbreak. It seems like it continues to get worse, though. So what do we know about the cause here?
Well, good morning, Diane. I know the last thing we want to do is talk about another global virus pandemic that might be impacting our kids. And in the U.S., we are seeing an increase in cases. 20 cases are under investigation. 4 children have required liver transplants, and 1 unfortunately has died. And so that is raising concerns, and especially among the fact that these kids were previously likely healthy. This hepatitis is an inflammation most likely caused by viruses, but it could also be due to medications or toxins. The cause right now is unknown, and I know that's not a great reassurance to parents. There is a potential association with adenovirus. Investigations are continuing. We saw an increase in adenovirus among kids alongside this acute hepatitis. So it's possible, but it's not been shown in all kids that have developed this condition. And so there's still a lot to do to figure out this causal link. You know, many of my colleagues around the country are working really hard to figure out what is behind this increase in hepatitis in our kids.
Now, we keep hearing about new potential long-term impacts of having COVID. Is there any potential link here?
Well, we don't know. You know, there's this adenovirus, there's COVID, there's maybe other viruses. We just don't know the interplay. There have been some of these kids that have tested positive for COVID, but not all. It's also really important to acknowledge the fact that most of these kids are not eligible for the vaccine. So even if you're seeing rumors out there that the vaccines might be linked, it's not possible because most of these kids are not even eligible if they get the COVID vaccine yet. There is one hypothesis that maybe kids have been sheltered for 2 years, that maybe there's some lack of exposure to basic germs that may have caused their immune systems to go into hyperdrive. But overall, we just don't know. It's possible there's a link to COVID, but we've yet to establish that.
Now, Dr. Brownstein, you mentioned that in Minnesota, 2 children needed liver transplant. In Wisconsin, a health alert was issued after 4 cases were reported, including 1 death. Alabama has now reported 9 cases. So what are the symptoms that parents need to look out for?
Right. So let's just lay it out here. It's very rare. So of course, parents are going to be on high alert, but overall, you know, kids are not coming down with this. There are a small number of kids, of course, that have been impacted, and you want to be vigilant to look for specific symptoms. Those are yellowing of the eyes or skin, vomiting, nausea, abdominal pain, dark urine, light-colored stool, fatigue, loss of appetite. So really striking symptoms, not sort of the basic symptoms that you see from seasonal viruses that kids have every year, but something that looks really out of normal. You know, you definitely want to talk to your primary care physician immediately.
So is there any sense of how we can protect our kids from this?
You know, I wish there was, you know, something, you know, you could offer here, but since we don't know the cause, it's very hard to figure out how to protect our kids. The basic thing that we have to do is just making sure that parents are hyper vigilant. They look for changes in the health of their kids and immediately contact their provider or go into the emergency department if there's really these very striking symptoms of yellowing of eyes or skin, you know, the kinds of things that are really different from the usual common viruses. But so far, you know, we just don't know the cause, and we sort of have to hang tight while, you know, scientists do their job right now.
All right, Dr. Brownstein, we appreciate it. Thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.